Good morning, everyone. So today our topic for discussion is methods of gaining space. So you all know the importance of having space in the arch for the correction of malocclusion. So we're going to discuss the following contents like introduction, proximal stripping, extraction, distalization, uprighting of molars, the rotation of posterior teeth, and proclination of anteriors. So coming to introduction. The correction of many malocclusion needs space in order to move teeth into more ideal location. The orthodontist often ends up in dilemma how to obtain space for this correction. So planning space is an important aspect of treatment planning. So most of the malocclusion, other than the spacing or the rotation of rotation of posterior teeth. So exceptional like this, for all other malocclusion need space or they need to have gain space for correction of particular malocclusion. So there are so many methods like how we can obtain or gain space. So planning space is an important aspect of treatment planning. So coming to proximal stripping. Proximal stripping is the easiest or simplest way for correction of minimal crowding or some kind of very minimal malocclusions. So method by which the proximal surface of the teeth are sliced in order to reduce the mesio-distal width of the teeth. This is also known as slenderization, disking, and proximal slicing. So you must be knowing the most common type of gaining space, that is extraction. So in extraction, you need to sacrifice the teeth. But here in proximal stripping, like you don't need to remove the teeth. All you have to do is just to trim off or remove some amount of material from the particular tooth. So, book a diagnostic aids. You need to have certain diagnostic aids to confirm whether to perform proximal stripping or not. So, those are arch perimeter analysis, Bolton's analysis, intraoral periapical radiographs. So, indications. Indications for proximal stripping are when space required is minimal, when when the amount of space to be gained is the limit, like from 0 to 2.5 millimeter. In that case, you can go ahead with proximal stripping. Mild tooth material excess in either of the arches, or to obtain more favorable overbite and overjet, and where individual tooth size prevent canine or molar relation. So in these cases, you can perform proximal stripping or slenderization. There are some contraindications. So, in young patients, what they have? They have a tooth with a very large pulp chamber and like thin tooth material. So, in that case, if you go on with proximal stripping, you're gonna expose the pulp because there is only limited amount of tooth material that covers pulp chamber. So if you perform proximal stripping in that teeth, there are high chances you're gonna get contact with pulp chamber. Okay, so contraindicated in such cases. High caries index, as they are susceptible to caries. The this proximal stripping cases, there are high chances of developing caries, small teeth and enamel hypoplasia, or poor oral hygiene and high bacterial plaque index. So in all these cases, you are not supposed to perform proximal stripping. So amount of proximal stripping, not more than 50% of the enamel thickness should not be reduced. So according to Sheridan, 0.4 mm reduction per each surface of posterior teeth and 0.25 mm in anterior teeth can be performed. So you all know that in general, the size of the posterior teeth are much bigger than that of anteriors. So definitely there is more room for proximal stripping in posteriors than in anteriors. Okay. There are so many methods for proximal stripping. You can use a rotor, a handpiece, and or you can use proximal strip. So coming to the advantages and disadvantages. Advantages are to avoid extraction in borderline cases. A more favorable overbite and overjet can be established with reduction of excess tooth material. More stable result by broadening the contact area and thus eliminate small contact point, which can slip and cause rotation of overcrowding. So all these are the advantages of proximal stripping, and coming to the disadvantages, it creates a roughened proximal surface. It increases caries susceptibility. It may experience sensitivity and result in the altered tooth morphology. So all these are the advantages and disadvantages of proximal stripping. Coming to the next method of gaining space, that is expansion. So expansion is an non-invasive method of gaining space. So it's undertaken in patients with constricted maxillary arch. It can be skeletal or dentoalveolar. Skeletal expansion is splitting of mid-palatine suture, and that's also called rapid maxillary expansion or dentoalveolar expansion, in which the dental expansion with no skeletal change is also known as slow maxillary expansion. Okay, so in basic, skeletal expansion is rapid and dentoalveolar expansion is slow. There are so many methods by which we can perform expansion, like RME, that is rapid maxillary expansion, coffin spring, cord helix, jack screw, native pedal expander, and the last resort is SARPE, that is surgically assisted rapid palatal expansion. So from all these, the only appliance you must be knowing is coffin springs, because you have done this in your preclinical exercise, coffin spring, either in second year or in third year, or other appliances must be very new to you, so you'll get it to know it. So the next method is extraction. Extraction from these figures. One is to extract and the other one is not to extract. So how does it matter? Like what actually matters for extraction in these figures? You will get it to know in next slide. So this is what nasolabial angle is. So nasolabial angle is the angle that is formed between your lip and your base of nose. If that angle is too acute, that suggests the proclamation of or protrusion of your upper anteriors. Or it's in case if it's obtuse, that means either your nasal floor is upturned or your incisors or upper anteriors are retroclined. So in the first figure, you all know that this is acute nasolabial angle. It suggests the proclamation of upper anteriors, which has to be corrected only through extraction. Then the second figure, the nasolabial angle is 90 degree. That is supposed to be normal, and you don't need to perform any kind of extraction. Even this guy has some kind of manipulation, because in case if you go for extraction, you're gonna open up this angle and turn words, like it go obtuse. So extraction can be performed when nasolabial angle is acute and not performed when it is normal or obtuse. So one of the most frequently resorted method of gaining space. Orthodontic extraction is also known as therapeutic extraction. So premolars are the most frequently extracted, either first premolar or second premolar, because it's location in arch, because both anterior and posterior manipulation can be corrected with removal of either of these two teeth, either first premolar or second premolar. So in this case, you can know so much of protrusion, dental protrusion along with crowding. There is no other option rather than extracting first premolar. So now see the mid treatment. Extracted the first premolars, started retracting, and how it finished. So this is the advantages of having extraction when it is needed. So that's all for today. See you in the next class.